Okay, welcome to Home Health Aid. We're going to go through the first unit of information. This is orientation to home care. I'm going to kind of skip through some of the stuff that it really doesn't pertain to the job itself. It's just a background. So this first section about how the home health services came about, we're just going to move through that. The biggest thing that you need to know is as of 1960, the term home health aid started to be used at that particular point, and that's when the government also, shortly after that, in 1976, they began to pass some minimum standards. Because prior to that point, there was no standard. It was just anybody and whoever came in off the street could be paid to take care of you or your family. And in 1987, the Omnibus Budget Reconciliation Act, actually, it's a federally mandated standard that says that nursing homes and home health agencies have to have guidelines, and you have to go through education, which is why you're taking this course, before you're able to actually do the job. So as you can see in the red, everything that's highlighted in red is important information that we have tried to make a little bit more bold for you. So make sure you understand and read the stuff in the red for sure. But CNA requires 75 hours of training plus clinical and skills lab. Home health aid is an additional 20 hours. You do have to have your certification as a CNA, so it's kind of a combination. It's a CNA plus the 20 hours that gives you your home health aid training. So we're just going to go through pretty quick this first set of PowerPoint pictures. The reason why we use home health care is so we can help control the cost of hospitals. Hospitals are extremely expensive. Patients don't like to be in the hospital. They prefer to be at home. So we send sicker patients into the home. So typically, a long time ago, it used to be if you were really sick, you'd be in the hospital. Now, you pretty much have to be dying or on like really, really sick to be in the hospital for any length of time. So the majority of the patients are coming home. So that's who you will be taking care of. We're just going to function through or go through here quickly. Chronic illnesses, you need to know the difference between chronic and acute. Chronic is a lifelong disease. Acute is something that happens now. It's over. You don't have anything that happens because of it later. It's like pneumonia or the flu or something like that. Chronic illnesses are like heart failure and strokes and COPD and things like that, or diabetes. Terminal illnesses are diseases we expect to end in the person's death. Developmentally disabled clients that you'll be taking care of in the home health setting, they're severely disabled, chronically, lifelong, and that disability was acquired prior to the age of 22. That is the technical definition of developmentally disabled. Some examples are cerebral palsy and Down syndrome. And then mentally ill patients, as a home health aide, you will have mentally ill patients who are just not able to take care of themselves at home. So home health comes in to make sure that they are taking their meds and stuff like that. So then there's how do you pay, basically private pay. There's Medicare, there's insurance, there's Medicaid. Medicare is older than 65. Medicaid is younger than 65. And Medicaid is for disabled people and low-income families. Medicare, you have to be 65, and everybody over 65 qualifies. So, agency personnel, there's your director, your physician, your nurse. Your nurse is the one who actually sees the patients. They organize a plan. They talk to the physician. They get therapies involved of anybody who needs to have therapy. They order the home health aid. They oversee the home health aid, so that would be your direct supervisor is the registered nurse or case manager on that particular patient. Then we talked about the therapies. Social worker is also somebody that the RN could order through the doctor. She has to get permission from the doctor first. The social worker kind of helps the resident to get in contact with some of the community resources that can help meet the residents' needs. When I did home health, we had the social worker come out to a home that had a lot of bed bugs. It was just not a very clean house or a clean place, and the person wanted it to be, but they couldn't because of the bugs. So the social worker was able to get some people in there to clean the house, and that was all free of charge to the resident or to the client. So very important people. Then there's speech therapists. There's a dietitian and nutritionist that can come out if there are special diets that need to be followed. Your job. This is the bulk of what I wanted to show you. So routine home health functions. It's going to be light housekeeping. You do not have to do windows. You do not have to do baseboards and deep cleaning. Just light housekeeping in any of the rooms that you occupy, that you will go into. So the living room, the bedroom, the bathroom, the kitchen. Those are the main rooms, and the laundry room too, because you'll be doing laundry. You help maintain needed supplies. So if there's things that are missing or they need to go shopping or something like that, you will take the client shopping with you and get the supplies. That has to be ordered by the nurse. It has to be listed on your care plan, but those are things that you can do. Any of these that are listed in red are things that you as the home health aide could do. Now, home health aides, there's a couple different avenues that you can go. One is you only do Medicare, Medicaid showers, so you see the resident or the client 30, 45 minutes, a couple times a week to do a shower. So then you would clean the bathroom and do laundry possibly, or at least put it where the client could get to it and get it done themselves. Or you could be assigned a client for 4 to 6 to 8 hours every day, or a couple days a week or something like that. So it's pretty flexible, and there's a huge array of responsibilities. Pretty much anything you do as a CNA, you will do as a home health aide as well, in addition to some things. As a home health aide, you are in the resident's home, in the client's home, by yourself. So you are reminding and assisting the residents to take their medications on time, on the schedule. If that's on the care plan, you are maybe changing non-sterile dressings. So if they have a small little cut on their arm and they have it bandaged, you may be responsible for taking that off and putting it back on and cleaning it up. Again, nothing is done without an order by the nurse and you being told that you need to do that and shown how, or make sure that you're competent in doing it. You'll assist with walking and doing some other restorative type exercises. You'll be responsible for knowing when therapies are supposed to be in the home so that you can make sure that the client has rested and is ready to do therapy. You don't want to wear them out, take them out shopping and miss their therapy appointment, or take them out shopping and get them home just in time, and then they're sleepy and tired, and then they don't get the benefit of the therapy when they get there. So you are part of a team in the home. You are a very important part because you are the one that's there all the time. So you need to make sure you are communicating with the nurse anything that is a change, a difference, and something that's been added, something that you just recently found out, or something like that. So you have an ethical code of behavior. You have to do right by your client. So ethics is concerned with what is right and what is wrong. That's what ethics is. You have to know the difference between right and wrong. As a HHA, as with a CNA, you fall under HIPPA protocol, HIPPA rules. You must respect confidentiality. You cannot discuss any financial issues, any personal issues, any medical issues with anybody that doesn't need to know. So you need to be honest. You need to have an understanding about yourself. If you're in a situation that you know you're not going to be able to get over and you can't give the resident the care that they deserve and that they are entitled to, then you need to talk with your case manager, nurse, and get yourself removed from that case if you cannot be if you're not the right person for that particular client. You have to refuse tips and gifts. You cannot be bought, okay? So even though Christmas time comes around, they're going to hand you money, say, hey, welcome, thank you for everything. You can't take it. You can take cookies, but you can't take cash. No sexual contact. That should go without saying, but we do have to say it. Liability refers to the degree to which you are held responsible for something that goes wrong on the job. So you must only do the tasks that have been assigned to you, that you are competent in, and that you feel comfortable doing. Okay? You cannot do anything more, anything less, because that puts you in a liability situation, that if something happens and you did something that you were not supposed to do, you will get in trouble and potentially lose your license. Be aware that the client's rights and responsibilities are the same that's granted to everybody. It's the same as the CNA if you're working in the nursing home. You have to protect those rights. That is the number one thing you need to do, is make sure that the resident at home is getting the same rights, is able to make their own decisions, is able to do what they want to do, and you're there to provide safety and any ancillary support to allow them to do what they need to do to maintain independence and safety. If incidents arise while you're in the home, you need to contact the supervisor immediately. If your patient's status changes, if they quit breathing, if they fall, if they tell you that somebody hurt them, all of those things need to go directly to your supervisor. You are alone in the home, but you are not alone. You have to utilize your resources. These are some liability pitfalls to avoid. I'm just going to have you read through those and know them. Be sure that you know that failing to report unsafe working and environmental conditions is a bad situation that you'll find yourself in if you don't report it. As a medical professional, you are a mandatory reporter, so if you hear or you suspect any type of abuse, neglect, exploitation, anything, you need to let the nurse know, the case manager know, so that she can investigate. You are not to be the one investigating. You are the one that is in the home. We want you safe, so you're going to push that off onto the nurse and do it in a discreet manner to where family and everybody do not necessarily know that you're the one that reported, but you are a mandated reporter. If a client, again, here we go, this is where it says you're obligated by law. So you could lose your license if something happens to a client and it is found out that you knew about a situation where they were being hurt or abused. You could lose your license and be held responsible in the future for whatever that may be. So please understand that and take care of your client as though they were your mom, your dad, your grandparent, somebody that you dearly love. Make sure that you are doing right by that person, by the client, by treating them the way that you would somebody that you dearly, dearly love and would never wish any harm on. So, all right, well, that's pretty much the first unit. Go through, read all of that stuff that you need to read, and if there's any questions, please don't hesitate to ask. Thanks.